All, I would like to ask your permission to use this video for educational purpose and on internet. I'd like to use this video for educational purpose and on internet.
Well, sure.
Okay. Now, how old are you?
I'll be 82 next week.
Well, congratulations. Okay. Now, 1.5 years ago, we did this surgery. This is a big surgery. We did the L1 to S1, what we call interbody fusion, and with the Olive technique. And the surgery actually went really well, and I have been following you up for the last 1.5 years, and I have here as well record of the surgery. But how are you now, generally?
I'm good.
Good. Any leg pain at all?
No.
So the leg pain that you had before is gone, completely gone?
As long as I behave myself.
Tell me about that. What does that mean?
Well, you just stay away from shoveling snow
Yeah.
and lifting heavy stuff like
Yeah.
that. But otherwise, I don't know. I if I do irritate my back, all I have to do is sit down for a half an hour.
Yeah.
And it's taken care of.
Yeah. So, practically this is exactly what I expect, that, with your age, obviously you have to be careful. No surgery can make you 40 again.
Don't, just be careful and it's
Yeah.
okay.
But you told me that the nagging, constant pain in the back and the leg is gone since the surgery. Is that right?
Yes.
So how bad was that pain that you had before the surgery?
How bad?
Was it before our surgery? How bad was the pain in your back?
Well, then you went and sat down, but it never went away.
Never went away. Yeah.
It never went away. Now it's
Just
good.
Just good. Yeah.
I'm happy with it.
Excellent. Now, and that surgery was 1.5 years ago, and we did it only in under 1.5 hours, and we lost only, the 130 cc of blood, really not much. Half a cup of coffee. That's how much blood we lost with that surgery. And you stay only 2 nights in the hospital. Do you remember the surgery?
Oh, yes.
You do? Okay.
Oh, I remember the surgery, but then we had problems afterwards with that.
What kind of problem did we have?
We had my sodium
Yeah.
fell down, and then it kind of screws up your mind.
Yeah. You were a little confused after the surgery.
Oh, yes.
Yes. And that is normal. Lots of people, especially elderly, after a big surgery, just anesthesia make them confused.
Yeah.
And that is actually the reason you stayed in the hospital only 2 nights. Because many people, even in your age group, I send them home 1 night after the surgery. But because your sodium was a little low and you were a little confused after the surgery, we kept you 2 nights. Do you remember when did the leg pain go away? Did the leg pain go away right after the surgery, or did it take a while to go away? I don't remember anymore.
I don't remember anymore.
That's a good thing. That's a good thing not to remember that. We don't want you to remember your pain.
No, I don't remember. I just remember that you'd have to sit down or lay down and then...
With the regular daily activities like walking, taking care of your basic need at home, is there any problem there?
No.
And that is the goal of the surgery, to keep you on your feet. I remember you had what we call claudication, meaning you couldn't walk long. Because when you walk, the pain used to get worse. Yeah. But so you're telling me now that problem is gone. Now you can walk and take care of your basic needs. What you cannot do is going and shoveling snow. Is that right?
You can't shovel snow.
That's right.
But I got a fishing trip planned for this
Excellent.
week.
Well, fishing trip is fine as long as you don't do too much bending, twisting, lifting, and you don't try to put a hole in the ice all by yourself.
That's right.
That's
right.
At certain age, we should have to just take care of our body. Our body is not
exactly
fresh out of factory anymore. So, but I think for most of things you're fine, and you don't need to see me anymore, except if there's a problem. It's a good thing not to see me. Okay. Thank you so much for the interview. I really appreciate that.